Hi, Michael Bloom, chiropractor. Thanks for watching. What I want to speak about today hasn't got anything specifically to do with chiropractic. It's just information that I feel is going to be useful for people that are interested in their health and well-being, and maybe for the people that have a slightly different way of viewing the fact that worldwide we're in the midst of a pandemic and there is a viral agent in the world, and it's, in my opinion, the viral agent isn't going to disappear, and it's more a matter of trying to transition our thought process from complete avoidance of ever being subjected to the virus to what can you actually do to minimize your likelihood of, if you are impacted by the virus, of how serious it is. I feel that the flu and the COVID are very similar, are going to follow a similar trajectory through history. The COVID-19 isn't going to disappear, it's going to be perpetuated year on year. We have to get used to it, but I feel like the message coming from the health bodies and hopefully from the governments will gradually transition over time to an acceptance that we need to live with this. But what can we do about it to minimise the likelihood of it actually being significantly impactful? There's lots of talk about vaccine trials and vaccines, and potentially that is something down the track. And as to your view on whether vaccines is something you would do, you know, that's a matter for individual decision making. But in the short term, something that I've become aware of just through some research and a lot of people involved in the research study gives me some sort of avenue for defence in the short term that is worth sharing with you. So what it is that I'm touching on is to do with vitamin D levels and the likelihood of deficiency in vitamin D levels having a correlation between the likelihood of developing SARS-CoV-2, which is the acute respiratory disease associated with the COVID-19 virus. So studies have suggested that there's an association between vitamin D deficiency and the risk of viral upper respiratory tract infections and mortality from coronavirus disease. This research study, by the way, was published in September 2017. It involved a group of people involved in the study of 191,000 people, studied through the course of 2020, so a lot of people. And cutting to the chase and to the important points within this, that there is a correlation between blood vitamin D levels and your likelihood of developing the SARS-CoV-2, which is the acute respiratory disease associated with COVID-19. So in conclusion, this is reading from the research, in conclusion, SARS-CoV-2 is inversely associated with circulating vitamin D levels. So inversely related, meaning that the higher the lesser the vitamin D levels, the higher the likelihood of the SARS-CoV. So what can you do about this? Well, it's make sure that you do whatever you can to understand your vitamin D levels, how to get correct vitamin D levels, whether you need to supplement, whether you need to get it naturally. But the first thing I would suggest doing is, if you are thinking about defense, rather than fear of I can't interact with the world at large because I'm too scared of getting the COVID-19 positive test, it's, well, what could you do so that if you had a positive test, the likelihood of it developing into something more serious may be minimised. Step one, make sure that you go and actually understand your vitamin D levels, go and get a blood test. And if you're deficient in vitamin D, supplement. Get on some vitamin D supplementation so you can increase your vitamin D levels. Aside from COVID, vitamin D levels have been linked, or deficiency in vitamin D levels have been linked to many other chronic diseases. So there's absolutely no downside in ensuring and understanding your vitamin D levels are where they should be. So take-home message is you can take some action, you can take some steps forward in minimising or mitigating your risk factors to do with COVID-19 besides all the isolation tactics, etc., and wearing masks, etc. And I'm not suggesting that these are things we shouldn't do, but I'm suggesting that there are things you can do to strengthen your resistance, because it is here to stay, in my humble opinion. I hope this is useful to you in this period of time we're going through, and I hope that you can follow this through, do some appropriate testing if you feel that you're interested, and get yourself strong and resilient. No matter where you are anyway, I hope you're having a great day. I hope you're staying healthy and well, and looking forward to the rest of the year and for onwards and upwards strength and vitality. Cheers.